is the I will cover respiratory alkalosis. Again, I will write the formula. Okay, you can clearly see pH is pH is inverse with carbon dioxide level. So in this case, I am trying pH is more than 7.45, so pH is raising. And now, what will happen to carbon dioxide? Carbon dioxide should be decreased. Okay, there should be hyperventilation. More carbon dioxide should be go out. Okay, when the more carbon dioxide will go out, pH will be increased. So that is called respiratory alkalosis. So easy topic. I'm just keeping the metabolic component to just simplify the topic. Okay, we can cover in the future lectures. Okay, how the composition occur, how to make differentiation. There are certain formulas to the make differentiation between the compensation and other disorder. Okay, so pH is raised. Okay, that is alkalemia, and carbon cell level are decreased. And you know, carbon dioxide is a respiratory component, so that is called respiratory alkalemia. So what is a mnemonic here? My awesome mnemonic here is 6P. Okay, let's mix Urdu, Punjabi, and English with the mnemonic. So first mnemonic is panic attack. P for panic attack. First is panic attack. Okay. Second mnemonic is word used in Urdu language. Okay, pahadi, pahad. Okay, that is a high altitude. Second mnemonic. Third mnemonic is pill. 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 Okay, the pill used here is a salicylate, aspirin, like that. So, okay. Fourth P is the mnemonic is thoda. The Punjabi word used here thoda. Okay, my grandmother have cancer and they say this is a thoda, that is a cancer. So that is a tumor. Okay, fifth P is the pulmonary embolism. Sixth P is the pregnancy. Seventh P is the pneumonia. Even patients stuck in elevator, that can be also called hyperventilation and anxiety. So guys, there are bloody 7P. Panic attack, pahadi, high altitude, pill, salicylate, thoda, P for thoda, like tumor and pulmonary embolism, pregnancy, pneumonia, like that. So that is respiratory alkalosis. In one word, we can say hyperventilation. Okay, even when you see a snake, your sympathetic system activated, you are having hyperventilation. So in one word, remember hyperventilation. When you are hyperventilating, like okay, your high ventilation is high, more carbon dioxide will be exhaled out. Okay, so you will have respiratory alkalosis. We are done with respiratory alkalosis with 6P mnemonic.